My name's Dan Augustine. I'm a general cardiologist with a subspecialty interest in cardiac imaging, sports cardiology and cardio-oncology. My main aim is to assess patients with high quality care and to ensure that their patient pathway in terms of investigations and treatment flows as smoothly as possible. In terms of general cardiology, I have expertise in assessing patients with a variety of symptoms or established diagnoses. So patients presenting with symptoms such as breathlessness, chest pain, palpitations, feeling faint or fainting episodes, right to patients with established diagnoses, so patients who have angina, who've had heart attacks or have heart failure or heart valve disease. In terms of cardiac imaging, I'm fully accredited in all forms of heart ultrasound scans, so from the standard transthoracic scan where there's ultrasound jelly on the front of the chest, which helps us look at the heart structure and pump function, all the way to the more complex heart ultrasound scans. And I'm also accredited in heart MRI scans. So this is the most detailed form of heart imaging where we can assess for heart artery narrowings, problems with the heart muscle such as heart attacks in the past, scarring or inflammation in a detailed study that takes about 40 minutes or so. In terms of heart ultrasound scans, I'm the chair for the education of the National British Society of Echocardiography. So this is the national society that governs ultrasound scanning in the UK. And as part of that, over the last couple of years, I've helped to lead on a number of national guidelines that have been implemented into UK NHS trusts, such as guidelines on what we should acquire for a heart ultrasound scan, so that's called the minimum data set, right the way through to how to assess heart pump function or heart valve disease. Over the last year, I was lead for the national implementation of the new COVID guidelines for heart ultrasound scans. And more recently this year, I was lead for NHS England guidelines on heart valve disease follow-up, and that's been implemented into UK practice in all NHS trusts. From a sports cardiology point of view, I'm one of the few cardiologists in the UK with a master's in sports cardiology. So I assess everyone right from people who have underlying heart conditions to those who have no heart conditions that want to increase their aerobic exercise, all the way through to elite sportsmen and sportswomen on an international scale, and also national and international teams. And what I really enjoy doing is helping those who have underlying heart conditions who want to increase their fitness or get back to partaking in their recreational activity. So this includes patients who, for instance, may have heart failure or have heart valve disease or heart rhythm disturbance, or patients who've had heart attacks in the past, getting back to exercising or starting to exercise, because everyone is individual and it needs to be a very personalised approach. And as part of my expertise in sports screening, I was one of the lead authors for the national guidelines on cardiac screening in sports participant that was released in conjunction with Cardiac Risk in the Young, which is a national screening society for sports participants. One of my other areas of interest is cardio-oncology. So this is quite a recent subspecialty. So patients who have cancer often have to have treatment to beat their cancer, but that treatment can sometimes upset the heart and cause heart pump dysfunction. And so I have expertise in managing patients with cancer. For instance, the mainstay is patients with breast cancer who may have chemotherapy medications or other medications that can impact on the heart. And I assess them and manage them to ensure that we can continue as much as we can with their cancer treatment without putting the heart at risk. And as part of this, I was recently the senior author for national guidelines, which have just been released over the last couple of months, and they're the first ever national guidelines and joint guidelines between the British Society of Echocardiography and the British Cardio-Oncology Society. Outside all of my work in terms of clinical work, I also have a really strong interest in research and education. So I'm the cardiology research lead at the Royal United Hospital Bath, and I've been appointed as an honorary senior lecturer at the University of Bath. So I lecture there and I help with research and combining NHS research with university research, which is really important in terms of taking patient care and adapting research into NHS clinical care. I'm also the editor of several national and international textbooks, a couple of which have been highly commended in the British Medical Association Book Awards, which I was really pleased about. Outside of clinical practice, I enjoy exercise. I enjoy running. I used to enjoy a lot of team sports prior to the onset of children, and so I spend a lot of time when I can exercising, but more so with my 4 lovely children. And I'm married to Ellie, who's a consultant paediatrician at the Royal United Hospital, Bath. I can remember my very first house officer placement in East London in the Homerton Hospital, where I really left university. I didn't know what I wanted to do, and I was taken on board by a Dr. Tunstall Peddo, who was about to retire, a sort of a godfather of cardiology in the UK. And I was just amazed at how you can integrate caring for patients clinically on a one-to-one basis to assess their needs with the more practical approach of cardiology in terms of the hands-on investigations. And it was that combination that really propelled me into cardiology. And after that first 3 months placement, having just left university, so 2001, I knew cardiology was a career for me, and I've been fortunate enough to be mentored by some of the top cardiologists in the UK, having trained in the Southwest and then gone on to do my research at the University of Oxford before returning to the Southwest to take up an NHS consultant post in Bath.
Amazing. What's it like working at the Bath Clinic? How do you find it?
Bath Clinic is fantastic. It's got a great rapport between all clinicians and patients. It has a can-do attitude where we treat patients on an individual basis, but also make sure they have prompt, correct treatment as quickly as possible. We all understand that this is going to be a nerve-wracking time for patients when they come to hospital to see a doctor, a surgeon, a physician. It doesn't matter which clinician, and we want to make that journey as smooth as possible.